Good afternoon and welcome to the Family Nurse Practitioner Residency Program Overview. We're so happy that you've taken the time to learn more about this program with us today. First, we want to get started with some introductions. My name is Lisa Fisher and I am the Senior Director of Member Services. Another important member of our team who's not with us today is Alexander Gill, and he is our Workforce Manager. And I'll turn it over to the CFIN CSULA team.
Right, I'm Dr. Lori Judson. I'm the Executive Director of the Chin Family Institute for Nursing. You'll find more about that in the next slide.
And I'm Zoanne Fitzhugh, and I'm a consultant and the Program Director at the Chin Family Institute for Nursing, and I'll be an integral part of your program.
And we have Diana Baez, who isn't here with us today, but she's the Administrative Support Coordinator for the Chin Family Institute for Nursing.
Great. So we just wanted to mention a little bit about our funding and our partners. This is the second round of our FNP residency program. Our first cohort was funded by Kaiser Permanente. We completed that in August of 2021 and learned many things, and we are excited to receive funding again from the UniHealth Foundation in order to do a new round with Cohort 2. And we are partnering once again with the Chin Family Institute for Nursing, and they are partnering with the Chin Family Institute. Maybe I'll just kick it over to you.
Sure. We're partnering with CCLAC, the Chin Family Institute for Nursing, as part of the Rong Shu College of Health and Human Services at Cal State University, Los Angeles.
Thank you. So just a little bit about CCLAC, and then I'll hand it over to the CFIN team. CCLAC was founded in 1996. We have 64 member clinics. We're an association that serves clinics across LA County. These clinics have over 300 clinical service sites and serve 1.7 million patients annually. Our mission is to promote free and community clinics as providers and advocates for expanding access to quality comprehensive health care for the medically underserved folks here in Los Angeles County. Just a little bit about us. We provide kind of what our members ask for. But the key pieces of what we do is we provide resources and advocacy. We do peer learning. We host a roundtable for very many roles within the community health centers. We have programs that include health fellows, AHEC scholars. We also do technical assistance, and that's with kind of workforce recruitment and retention, as well as we are a health center control network, and we're doing a lot on care transformation with the CalAIM program. We have multiple departments focusing on clinical services, government and external affairs, health and information technology, as well as member services and pharmacy, and workforce falls in the member services division.
And we are the Chin Family Institute for Nursing, as I said earlier, at California State University, Los Angeles. We were formed in 2016 with a philanthropic gift from Doctors William and Patricia Chin. And we're a center for nursing excellence, and we emphasize care for diverse, underserved populations. And we also are interested in the advancement of postgraduate nursing education and advocacy, leadership, and action. So this nurse practitioner residency program fits right into our mission. These are some photos of our first cohort. As Lisa mentioned, when we did this first cohort, it was an 8-month program, which we've since decided really does need to be 12 months. We had 8 residents and 4 clinics, and all of them are now still working at a CCLAC member clinic. and they were very satisfied with what they learned, and their measurement of learning also increased as measured by themselves and their preceptors. So 100% increased their performance baseline scores from month 4 to 8. And our residents came from across the country, so we expect that we may have applicants again from across the United States. We had very positive feedback from our preceptors, and who said that they were not only impressed by their growth, but the fact that they're well on their way to be competent primary care providers.
As you can see from the slide, we have 4 goals for this particular training program. 1, to expand access to primary care clinics. The second is to contribute to a workforce by increasing the number of FNPs that we provide to selected clinics. How are we going to do that? We want to provide, or will provide, a structured clinical transition experience from residency to primary care. And reading directly from the slide, you can see the 4th, which is upon completion, you should have a deep understanding of integrated behavioral health and primary care, which is team-based, including knowledge, skills, and procedures required to assist patients and their families maintain optimal levels of health. So access, contributing to workforce, improving competence, and giving you a deep understanding of what the FNP world is all about. Those are the 4 goals.
So thank you for the goals. And this is just kind of a brief overview of the program. It's a 12-month postgraduate residency. It's full-time. Everybody is, a fully licensed FNP, and that you can bill for services. Our tentative start date is September 6th. It's open to recent graduates up to 3 years into working as an FNP. If you have more experience, this really maybe isn't the right program for that applicant. We are looking to have up to 10 residents, ideally 2 residents across 5 different clinic sites. We'll have monthly check-ins, site visits, and resident/preceptor evaluations. There'll be weekly conferences with clinical faculty, and then the didactic training will be provided by CSULA nursing faculty. And this will be very sort of heavily front-loaded, with a lot of it happening in the first month, and then we'll space out throughout the term of the residency. The community clinics, we're in the process of, recruiting and finalizing the folks that will be participating, but they will be community clinics and federally qualified health centers. The locations will be throughout Los Angeles County. So last year we had folks in East LA. We had, actually most of the folks were in East LA, although we did have out in the Valley, and I think those are the primary locations, but it could be potentially to Long Beach, Lancaster, to Pasadena, to the West Side, where our clinics are located, but more to come on that. Patient populations, these are folks who are low income, primarily Latinx, patients experiencing homelessness, or patients with multiple chronic conditions, and many of which are on Medi-Cal. And the languages, we need Spanish. Most all of our clinics need Spanish-speaking clinicians. Of course, English and other languages are definitely, valued, because many of our clinics, we really aim to provide care in the languages of the communities we're serving. So salary recommendation. What we're recommending for the clinics who are hosting a resident is $100,000. How we came upon this amount was we took kind of what is the average salary for new graduate nurse practitioner in Los Angeles County. And we said, how can we adjust that to accommodate for the time out of the office? There'll be time in didactic sessions, in meetings, and many other things that we talked about in the program breakdown. And so that is how we anticipate that the residents will be in the clinic 86% of the year. And therefore, that's how we came up with this salary. And although these are recommended salaries, this is something that when you find your host site, you will have conversations, and that will be finalized when an offer is made.
This is a slide that addresses the preceptors that you will all have. Each resident will be assigned a preceptor, and you'll have regular meetings with them to present cases and receive feedback. And we're hopeful that these preceptors will model clinical skills and professional ethical behaviors and be there to observe what you're doing in the clinic. We're going to encourage them to use direct questioning methods and allowing you to reflect on the feedback. And we're also going to ask them to do a formative and summative evaluation at 6 months and 12 months of the residents.
The evaluation process is structured very similarly. The 6th and 12th month becomes critical. At the 6th and 12th month, the resident competencies will be completed by the resident and the preceptor. And that will be at the 6th month, as I said, and the 12th month. Dr. Judson already mentioned that you'll get some regularly scheduled feedback from your preceptor and clinical faculty. Preceptor and clinical evaluations will be submitted by you at months 3, 6, and 12. That's the formative. So that's as we go along so that we can change and if we choose to make changes or just to have a sense of how things are going. At the end of the program, there will be evaluations done by preceptors, evaluations that you will do, several evaluations that you will do. And just as an aside, we do have a program evaluator associated with CFIN. He will be sending out the information to you, but your feedback will be very, very important, as will the feedback of your preceptors at 6th and 12th months. Program objectives, as I said way back when, we want to expand the access to quality primary care for underserved and special populations. We want to contribute to the primary care clinical workforce, and 5 clinics will be selected, up to 5 clinics will be selected for your preceptorships. We anticipate retaining 80% of you. That's our goal. Dr. Judson mentioned that 100% stayed with us from the first cohort, but our program objective is to at least retain 80% of you, hopefully all. The program includes didactic and clinical learning experiences that are patient-centered, culturally sensitive, appropriate, and effective for the treatment of both common and uncommon health conditions and the promotion of health. Remember, you're in primary care, so promotion and prevention will be a critical element of your program. Also, for program, you're going to be evaluating we want to give you the opportunity to evaluate your own practice, and improve outcomes for patient care. It will be a continuous process of self-evaluation. We have anticipate a way of being able to handle that so that you can do it over a long span of time. You will practice with an interprofessional team, which is also very important. And population-centered care, as you know from your own programs, is very critical that we look at populations when we look at primary care. This program will also allow you an opportunity to demonstrate the knowledge you've established involving biopsychosocial, clinical, epidemiological, and nursing science for the provision of evidence-based care. I'm sure you've read that particular objective many, many times. Effective communication and collaboration with patients and families and interprofessional colleagues is very, very important in all areas of health. A commitment to carry out professional roles and responsibilities within the adherence to ethical principles, also very, very critical. An awareness of and a responsiveness to the larger context of the healthcare system. We'll spend some time looking at the healthcare system as a whole and how you are involved in it, and qualities required to sustain self-long growth in healthcare as a healthcare professional and leader. Again, leadership will be an integral part of the program and how you work within the context of the clinic. This is all going to happen in 3 different types of environments. Preceptive continuity clinics are the ones we usually think about. They're the primary care clinic. Here you're going to develop a patient panel. This is where you're going to have your primary preceptor that we've been talking about. This preceptor will be in this clinic and your panel will come out of this clinic. So a lot of your time, in fact, probably at least half, if not more, will be in this clinic. Specialty rotations, I think, are pretty obvious. They're the high volume, high burden, high risk areas that are within a clinic. A rotation may be in ortho, dermatology, women's health, and so on. It will depend on what specialty clinics that clinic has, and the way that and how you will be rotated through will depend on what's available. And we will work with each of your clinics to help them outline your specialty rotations. On both of those, you'll document. The reason why I say that is because a mentored clinic is very, very different. This is an opportunity to provide you with an opportunity to build additional, usually it's procedural skills or skills that happen more in episodic or acute care. Here you work with a mentor. It can be a physician or a nurse practitioner. The mentor always keeps the patient. In other words, you report to the mentor, you document, but the mentor signs off on the chart. So these patients do not become part of a panel. Again, this is a place where you can actually begin to build unique sets of skills that you wouldn't normally see perhaps in a specialty rotation or a precepted continuity clinic. This will happen much later in your program because we want you to go into these mentored clinics feeling fairly confident about your basic skills and speed and so on. So 3 types of clinics, precepted, specialty, and mentored clinics will be part of your training program. Clinical topics, I'm not reading this, I promise. So we're going to go over the big categories. They're fairly standard. You'll do work and assessment. You'll do work, critically, mental health and behavioral health. We really want to look at how we get those 2 integrated. So we will, with primary care. So we will be spending some time on that networking, that warm handoff that happens in mental health and behavioral health, which also, as you can see, cover some of the issues that confront folks with behavioral health diagnoses. Diagnoses seen in primary care are the traditional, diabetes, hypertension, and so on. Next slide, please. Then it just continues with pulmonary. You'll do work with women's health. Specialty care will be things like pain management, orthopedics, we'll talk about, and the rest of these will be usually seen in specialty clinics if the specialty clinics are available. If not, then we will cover them in a traditional didactic seminar. Prevention, again, it's the standard stuff, stages of behavioral health, self-management, HIV testing, and so on. Again, when you get a chance, you'll have an opportunity to read all of the things that we hope to cover in the 12 months that you will be in the program. When we talk about front loading, as Lisa said, front loading means you're going to get a lot of stuff at the beginning and then we're going to work it out. And probably the bulk of the things at the beginning will be that primary care content. Okay.
Great. Thank you for that. It's a lot of information and we will have these slides available. So if you want to go back.
Oh, good. Okay.
So this is just giving you kind of a sample schedule of how the residency will flow. As we said before, the start date will be September 6th. There'll be, I think the first day is in your clinic, and then, there's some orientation that has to happen there, and then you'll be with the faculty at CS or at Cal State LA. There'll be, week 2, orientation in the clinic, weeks 3 through 6. You'll be in class 2 days a week, and then the clinic 3 days a week. And so I was just talking about sort of the front loaded. This is heavier with the didactic sessions. Then week 7 through 9, class 1 day a week, and clinic 4 days a week, and so on. You can kind of see there will be, a build as spread out across the time. So for the program, this is just kind of a tentative timeline. Things are in flux, but we plan to keep as close to this as possible. The application deadline for applicants is May 31st. We have our application up at the CCLAC website. I'll take you over there in a minute. In June, we plan to start with interviews. That will first be with CCLAC and the Chin Family Institute. Then after our first round of interviews in July, we'll have the interviews with the clinics. And during those first interviews is when you'll learn more about the different placement sites so that you can weigh in as well to your interests. And we'll also, do what we can in terms of matching for interviewing. In August, we'll be doing final placements and kind of the beginning of onboarding, right? Is everything in order, paperwork, and then the program start date is September 6th. It's 12 months, and our end is projected for August 31st of 2023. So I think if folks have questions, you just reach out to us. We have our contact information here. I'm Lisa, I work at CCLAC. Alexander Gill will be the one kind of heading, receiving the applications and looking through those. But, also Lori and Zoe-Ann as we get going on some of the other pieces, or if you just have questions about the program. So I'm going to take a quick moment just to pop over to our website. I'm not going to walk everyone through the application, but just so you know how to get there. So here we go. So if you come to the CCLAC website, it's cclac.org, as you can see right here. You come to our front page and you can see if you scroll down, it's workforce. Just click that. Okay, and then you come over to the FNP Community Care Residency. You can also peruse and check out more, learn more about who CCLAC is. And you can see here, we have some of the frequently asked questions, application instructions, and the other supplemental questions for you to access that need to be attached to your application. And then this little button TBD, you'll click that and be able to get into the application. That will be up tomorrow, which is Friday the 13th. Ominous. Anyway, so if you come on over, click that button, supporting documents. If you have questions, please feel free to reach out to us. We're excited to learn more about you, to have a great pool applicants, and we're excited for a new year. So thank you so much for taking the time out today. Thank you, Lori and Zoe-Ann, for all the information you shared.
Thank you. Looking forward to it.